My name is Natalie Barton. I have been a nurse for 2.5 years. I work at Duke University Hospital in the intensive care nursery as a clinical nurse. I have been a Duke nurse for 2.5 years. I chose to come to Duke because my mom actually went to the Fuqua School of Business and got her MBA at Duke. And she actually named our brother, his middle name is Cameron, after Cameron Indoor Stadium. So clearly there is a love of Duke in my family. So I always just kind of wanted to work here because she loved it so much. One way that I lead with compassion in the neonatal intensive care unit is caring for these patients and trying to make the most positive out of what is the hardest walk that a parent can do, having a sick child, specifically one in an intensive care unit. One way that I do that is by making signs for patients to kind of signify some good points and, better accomplishments during their time in the NICU. I would advise a new nurse or someone interested in nursing that something important to think of is to take care of yourself. I feel like often in this field we put others before ourselves, and it's kind of like that old phrase in an airline, like you put your mask on first before helping others. I think as nurses it's really easy for us to forget that, and it's definitely no easy job. So I think from time to time we need to be reminded you can't pour from an empty cup. We need to refill ourselves first before going to others. Nurse recognition at Duke Health is different because we are a team of exceptional nurses. It's just astounding to meet the people that I've met here and get to work with them from other units, from other hospitals. Everybody really does come together as a team, and they just go above and beyond when it comes to advocating for their patients, which is something I haven't always seen elsewhere. I was inspired to be a nurse because of my brother David. He was born at 24 weeks of pregnancy, which is about 4 months premature, and unfortunately he passed away in the neonatal intensive care unit. It's my hope in my career that I would go on to give back to families that have lost a loved one, specifically that of a child, and in this instance, that of a baby. It's just something that I hope parents never have to walk through, so anything we can do to support them is important.